or collaborating with the patient advocacies in Mexican cancer clinics for almost since we started the program here. I know that Mexican Cancer Clinics was founded by a former patient that came to Mexico more than 20 years ago who was giving a very similar prognosis. She was not going to make it with conventional medicine, and she was treated in Mexico. She was put in remission, and she made it her life goal to spread the word about Mexico. In that time, she realized that unfortunately not all doctors are great doctors. Being in touch with so many former patients and recommending different centers, she got a grasp of which doctors were reputable ones and which doctors were innovating as far as treatments. She gets feedback from hundreds of patients every single year. It's based on that feedback that she knows which centers do best with X or Y diagnosis. I'm not going to say that the functional oncology does phenomenal with every type of cancer, but with the types of cancers that we do well. She asked us to review those patients' case. She helped set up an initial phone consultation. We put them in touch with the admissions director, and then we conduct a medical board meeting to determine eligibility. And if eligible, we present the patient with a treatment plan, which we also copy Mexican Cancer Clinics. And sometimes the patient is ashamed of saying, I don't understand what you're saying. We'll try to take as much time as we can, but sometimes the patients just won't ask any of our medical staff, but they will ask the patient advocacy center. So we actually, with the permission of the patient, sent Mexican Cancer Clinics a copy of the treatment plan that we recommend. I know that they have like a very nice conversation about what we're recommending, and Mexican Cancer Clinics advocates will try to explain everything in layman's terms that the patient can understand, and will share their experiences with patients that had a similar diagnosis with a specific center. They determine if we are a right fit for their patient and kind of guide their patients through every step of the way. I would say, since Mexican Cancer Clinics is non-biased, I mean, they don't work for us and they don't have a commercial agreement with us, you're talking to a non-biased part, and the patient wants that. The patient wants someone that has experience, that has knowledge, and that gets feedback from other patients. And if Mexican Cancer Clinics is sending a patient to us, the patient knows that it's because they found that we're a great center for what they're looking for. Mexican Cancer Clinics takes a tremendous amount of time with the patient, even before the patient gets to talk to a center, explaining what the different modalities of treatments are and learning what the patient is seeking. I think that's a huge plus for the patient as well, and the fact that they'll follow up after they've been discharged from a specific center. I know that their team is in constant communication with them, and that keeps us clinics in our toes. We need to make sure that we deliver phenomenal treatments, phenomenal customer service, because I've seen clinics come and go from that site. And the fact that we have been there for 9 years, well, tells you that we're doing something right.